Pan-India Registry for Progressive Supranuclear Palsy. An initial view. Pan-India Registry for Progressive Supranuclear Palsy is a collaborative work between the Parkinson's Research Alliance of India and the MedGenome Labs India. The project was initially had brought into proof of concept in 2021 with the target to finish the project by 2025. Currently, the study includes about 15 centers across India, wherein most of the centers have been onboarded and few of the centers are waiting for ethics board clearances. All the patient samples would be collected for detailed demographic data, geographic data, socioeconomic status, clinical symptoms, and treatment patterns. Some of these scales and assessment would depend upon the center and the permissions for those scales. Now coming into the initial clinical patterns of these patients. Till now, 227 subjects have been recruited with a mean age at recruitment being around 65 years and the age at onset being around 62 years. The mean duration of symptoms is around 38 months. Most of the patients tend to be male with 2:1 ratio spread between men to women. The patients represent across India, representing North, South, East, and Western Indias. Most patients have motor presentations, accounting for about 93% of the patients. However, small subset of patients present with predominantly cognitive or behavioral presentations, attributing for about 3% and 5% respectively. These patients met MDS PSP criteria with about 75% qualifying for probable PSP, 22% for possible PSP, and 7% for suggestive for PSP. The clinical phenotypes varied, and the predominant phenotype was the PSP-RS phenotype, then followed by PSP Parkinsonism phenotype and the PSP corticobasal syndrome phenotype. The motor symptoms and the non-motor symptoms varied in this cohort. The primary motor symptoms were predominantly bradykinesia in around 93%, followed by balance issues and falls, dexterity issues, tremors, stiffness, and writing issues, followed by difficulty in reading was noticed in around 50% of the patients, and double vision was documented in 19% of the patients. Non-motor symptoms tend to be more common, with urinary issues accounting for about 72%, followed by apathy in 58%, nocturia in 52%, anxiety in 34%, depression in 31%, and cognitive issues in around 41% of the patients. Coming to the genetic insights. Among these samples, all these samples where quality control was analyzed using genotype using Illumina Global Screening Array version 3. Based upon this, analysis has been done currently in around 122 PSP samples with a control of around 1,163 samples. This post-GWAS analysis included markers were filtered for a stringent R2 of more than 0.8, and further a nominal genome-wide significance of raw p-value of less than 0.01 threshold was used for annotation. Based upon these things, there are few of the genes were standing out, and these included in the names of like CSMD. Further, a Magma tool for gene set analysis for GWAS summary was done, wherein we could notice that myome3 and SYNGR4 were standing out as segregated from the rest of the cohort. Currently, the genetic samples of 122 patients are just an initial peek into our clinical genetic analysis. Additional samples is required to confirm the findings in this pilot study. To remember, the clinical patterns, what we are noticing does represent a pan-India PSP phenotype. This is a large pan-India cohort which is going on, which with the intention to recruit around 1,000 patients in the next 18 months. Please do note that the study is still ongoing and current data represent an early trends. Our final outcomes would be based upon the whole cohort analysis. We would be looking forward for any queries, suggestions, advice, or funding opportunities To work with us, please do contact Dr. Prashant LK at drprashantlk.gmail.com. Thank you.